The practical approach is an interactive learning program designed to complement traditional learning models in bronchoscopy training. The purpose of this video is to familiarize users with the philosophy and design of the Practical Approach Learning Series. To be a proficient and competent bronchoscopist, one must always consider the three major elements of a procedure: strategy and planning, technical execution, and response to procedure-related adverse events or complications. Cognitive skills such as knowledge of facts are enhanced by reading, and technical skills such as manual dexterity and instrument manipulation are mastered using simulators as well as at the patient's bedside, working through patient-centered exercises accompanied by the review of pertinent photographs, illustrative videos, and figures. These skills can be combined into an experimental learning activity which, similar to having an apprenticeship with an experienced and knowledgeable mentor, allows learners to contemplate on sets of patient, disease, and procedure-related issues in an ordinary and more uniform fashion. This is done through a four-box, patient-centered practical approach methodology inspired by Albert Johnson's classic work in medical ethics. Although the methods are applied to airway procedures and disorders and target mostly pulmonologists, the template is universal and easily generalized to practitioners in other medical specialties and to other disease processes. The four-box practical approach to interventional bronchoscopy is an interactive learning program designed to complement a traditional apprenticeship subspecialty training model. Its purpose is to help learners acquire the cognitive, technical, affective, and experiential skills necessary to perform minimally invasive bronchoscopic procedures in a patient and family-centered care environment. In the Practical Approach series, topics are addressed in a way that range from technical to ethical, from social commentary to evidence-based medicine, from descriptions of subjective assessments to the valued objective experience of experts. In this instructional video, we will use one case to demonstrate how the four-box Practical Approach series works. Practical Approach exercises can be completed alone or in a group, with or without the guidance of an instructor or mentor. Patient-centered scenarios prompt learners to address major components of the procedure-related consultation and informed consent process, as well as outcomes and expectations consistent with professionalism and competency guidelines. At the beginning of each practical approach, a list of learning objectives are provided, which will be revisited at the end of the exercise. Each practical approach series begins with a case description. Real-life cases are used, however certain details can be modified to protect patient privacy. In the current example, we describe a 60-year-old non-smoking female with lung adenocarcinoma which has progressed on therapy. She was referred for repeat bronchoscopy and biopsy to guide chemotherapy options. Relevant medical, social, and family history are then briefly reviewed. Here, the four-box model is introduced. We begin with the initial evaluation. This includes examination and functional status, significant comorbidities, evaluation of patient support system, as well as patient preferences and expectations. The depth of review of each of these topics varies from case to case. For example, the current patient has no major comorbidities, but in a patient with underlying cardiac disease, considerations regarding anesthetic agents and need to hold antiplatelet medications would become much more relevant. The next box in the four-box model is procedural strategies. Here we review the planned intervention with attention to indications, contraindications, and expected results. Team experience, risk-benefit analysis, and the informed consent process are also reviewed. This is used as an opportunity to review and consider the goals of the intervention and the necessary technical skills and equipment needed to achieve those goals. In this particular case, we use procedural strategies as a launching point to discuss in further detail the indications for repeat bronchoscopic biopsy in EGFR-positive adenocarcinoma. In each of the exercises, attention is focused on unique components of the procedure-related consultation. In this section, the risks and benefits as well as potential alternatives are discussed. In this case, they are only briefly reviewed, but the importance of these steps should not be minimized. We attempt to stress in all of our cases the importance of exploring alternative options and informing the patient of potential complications which could occur as a result of the intervention. Next, we move to the third box in the 4-box model, which is techniques and results. Here, we review anesthesia and perioperative care, as well as the techniques and instruments used. Anatomical dangers and other risks to be aware of pre-procedurally are discussed, and finally, results of the particular intervention and any procedurally related complications are discussed. In this step, images and videos from the procedure are often reviewed, and technical aspects of the procedure can be discussed. In this particular example, emphasis was placed on sampling yield of different bronchoscopic diagnostic techniques. Different teaching points are emphasized depending on the particular case. We next review the immediate results of our intervention and discuss any procedurally related complications or adverse events which may have occurred. We then move to the final box in the 4-box model, which is long-term management. Topics for review and discussion in this section include outcome assessment, follow-up testing and procedures, need for further referrals which occurred as a result of the intervention, and finally, quality improvement aspects. In this case, the tissue sample obtained was sent for molecular analysis in the absence of pathological confirmation of malignancy in the sample, which is not a recommended strategy. We believe that one of the strengths of case-based learning is that it acknowledges procedures do not always have perfect outcomes and emphasizes the importance of examining how improvements can be made. Further referrals to include oncology, surgery, and palliative services are next discussed, as well as the rationale behind that particular referral. Emphasis is placed on the understanding that the role of the interventionalist does not stop when the procedure ends. Specific quality improvement issues were then discussed, as well as how our procedure altered the care of the patient. In the current case, this time was spent reviewing how one can interpret genetic mutations in lung cancer, as well as the mutations found in our patient. Finally, we return to the learning objectives mentioned in the beginning of the exercise. The answers are revealed, along with a brief review of the evidence. This section is used to reinforce the points made during the case and allows the reader the opportunity to reflect on what they learned from the case. We hope that this video provided a framework for using the 4-box model for review of cases as well as a means for self-evaluation. We encourage you to further explore the current library of cases at bronchoscopy.org, where you can also submit interesting teaching cases of your own.